Welcome to the Not My Job Pod. I am your host, Emily Gant, and today I am joined by Alex Suarez, who is a Berlin-based relationship and sex counselor. Thank you so much for joining me today.
Oh, thanks for having me, Emily.
And tell me a little bit about how you got into this. I feel like sex counseling, relationship counseling is a very hot topic in Berlin right now. So how did you find yourself here?
How did I get into this? In my first year of uni, normally you're supposed to take these very basic undergrad courses, right? And I happened to just choose history of sexuality, which was way above what I was supposed to take. And I just loved it. It was fascinating, very complex. And that really kind of opened up the door into me wanting to explore and learn more about sexuality, gender studies. And that really was the beginning of it all. Then I went and kind of worked in sex education, which then opened up the door to work in sexual and reproductive health. So working more within a medical context. And then, then quickly realizing that I really loved working with people one on one. But within the medical context, there's only so much that you can explore with people. It's also very clinical. And so then from there on, I, open up the door to, counseling and then exploring that possibility, but from, of course, a much more personal point of view.
So how does counseling kind of allow you to get more personal than medical? Can you expand what you mean by clinical versus personal?
So what I meant by that is within like if you're working at a clinic or, doctor's office, there is a lot of pressure to see patients under a certain amount of time, right? In a way, sometimes it is very number driven. And so you can ask patients what, some of the symptoms that they're having and yeah, maybe what's happening in their lives, but you don't have the time and space to help individuals kind of process maybe experiences that, I don't know, felt confusing around their health, sexual health within this context, right? And so I guess like a really good example is somebody is experiencing challenges, with regards to their sexual health, but it kind of becomes reduced down or kind of simplified to, well, did you do this? And, have you taken this medication, right? And really not getting curious about the psychological and emotional factors that actually may be at play as well, right? And also not having sometimes enough time to provide psychoeducation or even medical education, right? I'm maybe painting a bit of a negative picture here. But with counseling, even though I don't work with, sexual health too much, if that does come into my office, I have the time and space to really go through everything, right? And also to provide the education that is needed for clients to then kind of form really, yeah, informed decisions.
How should patients in general think about, maybe they're in a relationship and they're not very happy. How do they decide if they just need regular therapy or if they need like a relationship counselor or,
Mm.
um, yeah, some sort of sexual health orientation, or how do they figure out what they actually need to go get?
Yeah, I mean, I think the most important difference is, when we're talking about psychotherapy and counseling, right? Psychotherapy, we're really looking at practitioners that have a background in mental health issues, right? So that are also able then to work with different types of diagnosis, right? So somebody that is maybe experiencing obsessive compulsive disorder, right? And then with counseling, I'm not really looking at a diagnosis. I'm also not able to provide a diagnosis. So I think that's the most important thing, right? When it comes to working with couples, right? If one of the individuals is, I don't know, has been diagnosed with narcissistic disorder or, something to that extent, that I think that particular client would benefit then from having a psychotherapist to be in the room with them because then they're able to integrate, that kind of expertise, if that
Okay.
makes sense. Yeah.
It does, it does. So it's almost kind of freeing sounding that you aren't providing a diagnosis. It's sort of like
Yeah.
you're more about the process. So could you tell me a little bit more about what that process looks like for either someone you work with now or a prospective client or just in general?
Yeah. So maybe what would help out is to understand that my process or my counseling modality is integrative. And so what I mean by that is that I don't ascribe to one single school of thought, right? So I integrate different counseling modalities into my work. And so really how that process looks like is I really get curious about my clients' upbringing and family dynamics. There's this really nice quote by Esther Perel, which goes, "Tell me how you were loved, and I'll tell you how you make love." So really kind of understanding attachment styles, understanding some of those core wounds that we carry, for example, fear of abandonment, fear of being too much, fear of not being enough, right? And then how that then kind of plays out either in their relationship with their partner or how that actually is manifested in sex. You know, what are the things that motivate us to have sex? And sometimes it's, yes, drive, and sometimes it's very psychologically driven, meaning I am afraid of losing this relationship. And for this reason, I feel like I need to have sex. So then that elicits a whole set of different, let's say, psychological responses that are not counterproductive either for the individual or for the relationship. So that's just one tiny example, right? Then we get into understanding who they are as a sexual being, right? How did they learn about sex? What messages and narratives have they internalized from society, from family, from culture, from religion? And then really working and unpacking shame, taboos, trauma, right? So, yeah, depending on the case that I'm presented with, I kind of go into different paths. But it just gives you an overview, I guess.
Definitely. So, because you've worked in a couple of different countries as well, I'm curious how you find, and I know you probably don't want to generalize like an entire country, but it's like, people always say Germans are direct, or I don't know, maybe Americans are too pushy in the way that they talk to each other, or are there ways that you see culture kind of shaping people's sexual problems that they come, or relationship problems that they come to you with?
That's a really good question. I mean, I think, and I really don't want to speak for everyone or generalize communities, but I think maybe one of the biggest differences between the US and Germany is that in the US, there is this expectation that individuals should follow this kind of timeline. And that timeline involves certain milestones around their relationships and milestones around when they become a parent. And I think when you look at like the contrast between that and Berlin, right, because I can't speak for the rest of Germany, there's the paths are so much more varied and there's so much more, I think, tolerance and openness to exploring a different lifestyle, right? Whether that is kind of in the relational dynamics that we choose, going into an open relationship and being very open about it, or like, with sex, like, being open about the fact that, you go to sex parties and that's just part of, normal life, right? And it's not to say that, I don't think that people in the US don't do that. I think they do, but those that maybe engage with that feel maybe a lot more pressure to keep that quiet or not to be so open about it.
Do you feel that you were already quite acquainted with the wide world of what is out there before you moved to Berlin? Or do you think that Berlin kind of opened your eyes, whether it was like in exploration for yourself or just hearing stories from people you were working with or exploring the city on your own? What was that exploration process like for you here in Berlin?
Yeah, it was eye-opening, for lack of a better word. I think, yeah, the word that's coming to mind right now, it's wild. I
Mhm.
Here in Berlin, that's what I feel like. And yeah, I love that people feel so comfortable with this part of themselves, and that there is so much openness around it. So, yeah, I think living in Berlin at the beginning, I didn't know what to expect, and then once you kind of become acquainted with it all, then you're like, oh, okay, so this is out there, and that's okay.
Mhm.
Yeah.
Do you think though, because I do think that Berlin gets this reputation for being, super open around sex and hedonism and that sort of thing. But then on the flip side, I do still have like a handful of friends who are like, no, I would like to be in a monogamous relationship and I'm looking for a long-term partner, and they are struggling to find that. So I'm curious, what are your thoughts on, I guess, either people exploring open things and trying to stay open-minded in a city like Berlin versus, people who kind of do know what they want and maybe it is more conventional. How do they navigate that in Berlin?
That's really hard. That's really hard because I kind of like what you just said. I think there are a lot of individuals who would prefer to be in a monogamous dynamic. but yeah, it almost feels like they are kind of going against the norm. I don't know, in a way that kind of in the US feels like the flip side, right? I think with navigating those scenarios or realities, I think it's very important to stay true to yourself, right? I don't think molding ourselves around what others or other people around us are doing will take us where we actually want to be. I mean, that may sound pretty common sense or pretty basic, but I think oftentimes a lot of the work that I do with clients is people mold themselves, right? They hide parts of themselves or they adjust accordingly. But yeah, then we're kind of faced with the reality of actually this isn't what I want, or I enter an open dynamic. I think exploring is great, right? But if ultimately it causes pain, then just to be mindful of, why is it that I'm doing this here? And I don't know if that quite answered your question, but I guess it's more just around self-awareness of what are my values, and if it doesn't resonate with me particularly, then to know that that is absolutely okay. And I would love for my clients to think that they don't have to adjust just because that's what maybe mainstream society is, at least in Berlin, kind of advocating.
I definitely agree that, yeah, what is mainstream in Berlin is the polar opposite of mainstream in the rest of the world.
Yes.
But I'm curious to have you expand a little bit on kind of, I like what you said about whatever you're experimenting with should not be causing pain, either in your relationship or within yourself. And so if people are in Berlin and they're kind of thinking to themselves, okay, I would like to explore, whether that's something as simple as like going to a club where there might be sex happening, around you and you're not necessarily even involved in it. And maybe that's someone's comfort zone, or it could be as extreme as going to either a sex party or opening up your relationship or trying different kinks and that sort of thing. I'm curious, what is your advice to someone who's trying to explore that, but then also minimize their own pain? Like a genuine curiosity, but an uncertainty. What's a safe way to go about that?
Yeah, I mean, I think the relational aspect is a little bit it's much more complex, right, than just going to a new space or going to a sex positive party. I think the first thing that I would ask my client is, tell me a little bit about why you want to do this, right? Understanding the why, I think it's very important. Um, is it trying to fulfill a need? Is it driven by curiosity? Or is it driven by you feeling like you are not open enough, right? So what's the why behind it? And then I would then get curious together with my client around, okay, let's talk about your window of tolerance, right? So this, I don't know if you're familiar with this term. So every individual has a window of tolerance, that's influenced by genetics or upbringing, lived experiences, right? And it determines basically your capacity to from a psychological point of view to function, right? So if our window of tolerance, if we go over it, some individuals will go into hyperarousal or overfunctioning, and some individuals will go into hypoarousal, so they will shut down, right? And so I think that's also a really important thing to explore together. What is my window of tolerance? What are the factors that would maybe push me into a state where I'm experiencing a lot of anxiety, or I may have a freeze response, right? That's quite intense. So that then you take that awareness with you, right? So maybe going to a sex positive party and just observing, that's within my window of tolerance. Going to a sex positive party and engaging in any behavior, right? That might actually create some aftermath that I'm not ready to kind of deal with, right? And so then that's one example. And then when we look at it from a relational point of view, I think it's very important again to understand the why, and to also be aware that opening up the relationship is not a sort of kind of band-aid for problems that the couple is facing, right? So that it's not coming from a place of emotional needs not being met, because then that will just, I mean, that's not sustainable, right? So making sure that the couple really has a very solid foundation, that there's trust, that there's communication, and then only then kind of, venturing and exploring this dynamic. And then a lot of psychoeducation, a lot of reading, like Polywise, Polysecure. You want to kind of do it in steps. You don't want to go from 0 to 100, because that might actually push someone too much. So then kind of playing, and then you expand that capacity gradually. so that both individuals feel comfortable with that process, because it is a lot to ask, especially if your relationship started monogamous. It's a massive transition. It's a lot of kind of rewiring that needs to happen.
So I'm curious though, like when people are asking themselves, like, okay, if you're in something monogamous or maybe you're just interested in exploring, and obviously I know you're probably going to tell me there's no good or bad reasons, but what are some like green flag reasons that you hear from someone and you're like, oh, maybe this person just is genuinely interested and ready to explore, either alternative lifestyles or something different, or what are some green flags that you look for that you're like, yeah, go for it.
With a couple, you mean?
Either with a couple or someone who's seeing, because you have clients as well who come on their
Yeah.
own.
Yeah, yeah. I think yeah, I don't want to use any examples, but when I'm working with a couple and there's a lot of accountability and responsibility, like shown in the relationship, that's a massive green flag, right? So there's a difference between I want to explore sexuality because I want to explore and get curious about different facets of who I am within that context. And then there is, I just need to have more sex because my drive feels uncontrollable. This latter to me feels like a red flag. The second one or the first one is a green flag to me, right? Because the latter, the second where it's my sex drive is uncontrollable, or, that is probably driven by dysregulation. And from a psychological point of view, it may also be driven by disconnection, loneliness, boredom, isolation, you name it, right? So if we choose to kind of open up this door, then I think accountability, responsibility, self regulation are key factors here.
Okay. So as far as exploring new things within the Berlin open scene, you would say it's more about, or people should be approaching it as a self-exploration more so than like physical needs that they need met.
I don't want to, what's the word, downplay or invalidate someone's needs. But I think sometimes we confuse needs with dysregulation. And so if somebody tells me I want to explore sex, I want to have all of these kinds of experiences, that's great. When we switch to needs, then there's this kind of like, then your partner's responsible there's this dependency that to me feels it's almost like my well being depends on it. And my question is, does it? Right. And what is it about maybe owning the other bit more that you're not approaching it through that lens? Right. I don't know if that makes sense.
It does. It does. It does. It makes a lot of sense. Awesome. Yeah, I think I don't know, it's just so interesting to I guess from myself too, I see like a lot of friends who are in different relationships kind of navigate this and it's fun. That sounds terrible. It's fun to see my friends mess up. No, it's fun to see just people like exploring different dynamics and then some of them come back and they like talk about it and it's fine. And then like some of them like, it just turns into a whole thing. And so kind of all the different ways that it can go. Because I think there are more avenues here in Berlin.
And maybe just to add from my side, going back to the dysregulation piece, um, sex has wonderful effects, right? It brings down cortisol levels, like oxytocin is released, right? It makes us feel so good, right? But again, if we're using it subconsciously or without our awareness as a way to help us calm down, right? Then that's a very different conversation to I want to explore and learn more about me and how my body feels in these scenarios or whatnot, right? That's a very different conversation.
Yeah, definitely. And beyond just sex in general, which I feel like people are often talking about in Berlin, but I'm kind of shifting into more of the relationship counseling aspect of your work. I'm curious kind of how the different cultural aspects kind of shift how you have to address different relational aspects within the people you work with, past and present, or just in general, if a friend is telling you a story and you know that, he's from, Argentina and she's from Germany and like obviously the cultures are different and like if you have friends who are from Argentina and Germany I don't know I just made that up but yeah, I'm curious how kind of being an immigrant in Berlin shapes the experience, and then also just different cultural aspects get navigated in relationships or problems that people see.
Yeah, I mean, I think culture plays a massive role when it comes to how we relate and how we view sexuality. So, when I'm working with a multicultural couple, I think what's very important is not to assume anything, right? My normal is not your normal. And, what is normal anyway, right? So, getting really curious about, what, again, I think I said this at the beginning of our conversation, but what are some of the messages or narratives that you've learned from your culture or that you've internalized along the way, right? And some of those stories could be around expectations, right? As a woman, I am expected to have sex with my partner when, you know, he is turned on, right? And then we get curious about the other partners, again, cultural stories or stories that they've adapted from their culture. And then what's really nice is that then we get to ask them, well, is that what you want, right? Does that feel good to you? And if it doesn't feel good to you, let's define a new vision for what you want out of your relationship. But yeah, not assuming anything. And also when working with multicultural couples, I think a language also plays a massive role, right? And so we're going from English not being the native language, and then we have two individuals that are maybe sometimes missing each other in terms of what they say something but what it actually means. And so getting curious also around the meaning and okay, what does that actually look in tangible terms for you, right? What does love mean to you? I mean, it varies from person to person. How do you feel loved? What does that actually like what's the felt sense of that experience for you? So, yeah, a lot of curiosity in that process.
I have some friends who they both speak English, but it's neither of their first language. Usually when they get into an argument, they do it in English because it puts both of them on an even playing field because they both have different first languages or mother tongues, I guess. Are there any sort of tips for I don't even know if that is like a good tip as far as like it works for them, but I don't know if that would work for everyone or just be incredibly frustrating. But I'm curious if there are any kind of tips that you have for couples who are navigating yeah, different languages or language barriers or cultural barriers.
I mean, this is going to sound maybe redundant, but I think it's incredibly powerful curiosity. Right, get curious about each other's experience, values, and ask questions. Lots and lots of questions because even when it comes down to the words, what does that actually mean for you? Especially when there's a language barrier, or maybe, two people come from very different cultural backgrounds. I think that's the best thing that I would recommend. And, or go to couples counseling, right? That's why I'm here to help bridge that gap because sometimes it is about bridging that gap. And it's crazy. Sometimes I'm working with couples and the assumptions that are made from one another are like just so off. And so challenging that and actually bringing a mutual understanding is a massive part of the work that I do with them.
I was talking about what you just said reminded me of something that not a romantic relationship, it just happened with a friend recently where I'm known for being very direct and me just saying like, no, I don't want to come, or it's not a reflection on the person, it's just kind of how I communicate. Or if something's bothering me, instead of stewing on it, I'll be like, you haven't responded in a week, what's going on, you know? And then sometimes people react to that. But the people in my life who have the context know that it's not coming from a bad place. It's just instead of me getting angry about it, I just ask. And it was just funny because with a friend of mine, I did that. And then she looked at me like kind of offended. And then because we hadn't seen each other in a few months. And I was like, why would you assume that I wasn't saying that coming from love and light? And then we
Yeah.
both just like erupted in laughter because it was just so aggressive the way that I yelled at her as far as like the love and the light. But I think, yeah, what you were saying about assumptions is so true. Because yeah, you do have to look at the context of like what is the person saying and what is the history, and surely they don't intend to be rude or mean or dismissive.
Yeah, yeah, yeah. And it's crazy though, because when you're in a relationship or, relating to another individual, it doesn't have to be a romantic relationship. There is culture, context, of course, language differences, right? But then we add the communication challenges, meaning deep down inside of me, I'm actually in pain. But instead of communicating that, I blame or I go into shame mode, right? And so then it's unpacking that extra layer of more of this on the psychological side of things. What is happening on an emotional level? And, where's the gap here? So that also, I think, increases the complexity sometimes when we're trying to understand each other.
Yeah, I think it's so hard just in general. Like you said, within friendships, romantic relationships, beyond, it's just, 'cause yeah, there's so many layers. And also sometimes, I don't know, somebody will say something to me and I have to just be like, I can choose to take this nicely, you know? Sometimes it is, deep and important to like perfectly understand the people you're around, but I don't know. Also, sometimes I'm like, I could just choose to assume that this was meant with like positive intent and move on with my day. Yeah. So I don't know. Uh, maybe that's something for me to unpack in therapy one day, but we'll see. No, I'm just kidding. But or am I? But with Germans specifically,
Mhm.
do you find because Germans are we constantly say that they're very direct.
Mhm.
My hot take is that they're not so direct when it comes to things that are emotional or things that are about feelings, but culturally mixed in with what you've seen in your practice.
Mhm.
Do you think Germans are as direct as they say they are?
Well, I think it's interesting because I think you can be direct, but you can also be direct and communicate from a vulnerable place, right? And so when I'm talking about vulnerability, I'm really talking about being able to tap into emotions, negative feelings or heavy ones, right? And a lot of people don't do that because it's risky, right? In terms of if I actually open up, will you be there and hold space for that? Or will you make me feel worse, right? So I don't think it's so much about being direct. I guess maybe from my professional experience, I wouldn't say that it's about being German or not. I think across the board, I see people lacking the vulnerability aspect.
Okay.
And maybe from my professional experience, what I see is that it's a lot more difficult for men to tap into that than it is for women. And I
Okay.
think that comes from, we talked about this once, right? But this idea of boys are socialized around activities, girls are socialized around connection. And so for boys at some point it becomes, yeah, that skill is not practiced over and over again. And so of course it makes sense that then when they're adults that they're not able to tap into that maybe with the ease that some women can. And I'm not saying all women because some also have the same challenges.
So because you mentioned earlier that it also comes down to oftentimes some people are just dysregulated, like in their overall nervous system, kind of causing some of this to come up. So I guess in terms of maybe either men or women as well, I assume also sometimes need some sort of regulation. What is kind of that? It's polyvagal theory that you use in your work, and how does being vulnerable
Mhm.
intertwine with a regulated nervous system?
I don't think vulnerability necessarily equates to being regulated,
Okay,
right? Because
interesting.
I can be very grounded in myself, not have any anxiety, just very nice kind of line. But it doesn't mean that I will allow myself to tap into my fears or my pain or the traumatic experiences that I've gone through. Right? So I don't necessarily see one equating the other.
That's so interesting though, because it's like if I guess if someone's protecting their own peace, could that be at the expense of not being vulnerable enough when they need to be?
So say that one more time. Let's unpack this.
Yeah, yeah. No, I'm curious. Like, I guess I'm thinking of myself because sometimes when sorry, just using it as my free counseling session today. But in terms of myself, that's something that like if I'm feeling very like emotionally stable and like I'm very like okay, everything is good. I'm feeling good. I'm feeling very regulated, very calm. Like, something is silly happening at work, like, or, a car honks at me. That's not going to make me like get really anxious or, dysregulated in any way.
Mhm.
But then, for example, if I avoid having a difficult conversation with someone that I care about, then I am kind of protecting my peace in a way because I get to stay emotionally stable.
Yeah.
And at what point is that harmful behavior?
I mean, I wouldn't use the word harmful. I think maybe what would be good to get curious about is, from a psychological point of view, all behavior makes sense. It serves a purpose. So I think understanding, in this example, why what is it that I'm trying to protect myself from, right? Or what am I afraid of would happen if I actually do open up to this person? And even that, just understanding that, I think that can open the door to vulnerability.
And how do people know when they should be vulnerable with someone versus it's not really that worth it?
I think it boils down to safety, emotional safety. So kind of going back to vulnerability and being regulated, right? And I think it's also important to point out that just because I am cruising, meaning I'm not experiencing negative emotions, that does not necessarily mean regulation. That could also be a form of shutting down or a form of disassociation, right? I mean, maybe not disassociation, but it could be this kind of like I'm so distant from my emotions that that doesn't necessarily mean that you're actually regulated, right? It just means that you're suppressing. Going back to when would you say that it's okay to be vulnerable? I think going back to emotional safety. And I this is something that you can either with a counselor if you're not able to tap into that is what does it feel like somatically speaking internally to feel safe right now and to be safe with you? And if there's that sense of like I just relax and, you know, I don't I don't feel the need to perform around you or to say things or I'm not thinking about, how to act. To me, that's a pretty good sign that I feel emotionally safe around you, right? Whether I want to go into vulnerability, that's a different story. But that I think that opens up the door.
Mhm. I think yeah, that's super interesting. And also, I guess I'm just kind of thinking of, and granted, the concept of like any sort of therapeutic advice on the internet or social media is just highs and lows of a nightmare. But I guess there's just a lot out there about like, okay, if somebody is constantly like driving you crazy or someone is constantly like, violating your boundaries or, a bad force in your life, then you are just supposed to cut them off.
Mm.
And increasingly, I'm just I'm personally I'm not into that. I'm like, I feel like your friends, there's like that saying that like annoyance is the price you pay for community. And that
Mhm.
doesn't mean that all those people are your friends, but like sometimes you have to tolerate those people so that someone will help you move. And nobody enjoys certain aspects of community, but it's kind of yeah, you have to be able to tolerate some nonsense,
Of
and figuring
course.
out
Yeah,
where
yeah.
to draw that line.
Yeah, and it's really tricky, right? Because when we are relating to others, romantic partners or not, what we're faced with like the otherness, the otherness that then create a trigger inside of us. And a lot of people, I think, struggle with that or have a very all or nothing black and white mentality. And I don't think that's also maybe, I agree with you. I don't think that's the way to go around. And so just a lot of self-awareness and a lot of curiosity and questions that of course then you can explore in counseling, but is that coming from me not being emotionally safe or is that coming from me being triggered, and why is it that I'm triggered? Is it an invitation for me to reframe? Is it an invitation for me to grow, right? That those are also two different things, right? In terms of safety, right? If I'm in a relationship where I get beat up, that's not emotional safety, right? And that's a very different conversation to am I being triggered, and then what is underneath that trigger, and can I work with that or at least expand my capacity to relate with it so that this friendship or relationship is not lost or just this idea of kind of canceling people out.
So you're asking us all to be self-aware.
Yes, honestly, but we become self-aware through questioning.
Mhm.
And we become self-aware through self-definition, which is like an ongoing process, like it never ends.
And that goes back to your original point of curiosity, it
Yeah.
sounds like. Yeah.
Yeah, yeah. I would if like it's like my word, the bread and butter to my work, curiosity.
Okay. That makes sense. So then speaking of kind of getting curious, I want to ask a little bit more about we've talked about shame before
Mm.
as kind of a driving factor in a lot of people's behavior, whether it's sexual shame or, like you said, they have intrinsic beliefs and it like hijacks how they feel they should perform in a relationship or in a sexual dynamic. So how can people get curious in order to alleviate the awful sensation that is shame?
Shame is such a complex and layered emotion. And I think maybe one key part of counseling with regards to this topic is helping individuals understand the difference between guilt and shame, right? So guilt is behavior based. So I did something wrong, and shame is I am wrong or I am broken. And so with shame, it's so deeply ingrained, right? Sometimes it feels like, when I'm exploring this topic with clients, it's like all pervasive. Like I'm walking around with this thing that's just covering me in it. And with shame, I don't know if you're familiar with Brene Brown's work around vulnerability and shame.
A little bit.
Yeah. US based. I don't know if she's a psychologist, but definitely working in the field of psychology. The three things that, let's say, solidify shame: judgment, secrecy, and silence. And so when my clients come in and we slowly start to unpack some of the things that create shame for you, or for them rather, that is such a big part of that work. Even them just saying it out loud for the first time. So we're breaking the silence, we're breaking the secrecy. And if you're working with a good counselor and psychotherapist, there should be absolutely zero judgment, right, in that process. So that's how, but it's a very slow process, right? Because again, it's so deeply ingrained. And especially when it comes to sexual trauma, right? That
Hmm.
that carries another layer of self-blame, right? And how they relate to their body, right? So feeling like their body betrayed them. Anyway, it's quite complex, but just to give you an overview of what that kind of work would entail.
Hmm. Definitely. And I'm curious too, that just made me think of this. It's a weird thing to relate. But yeah, just like the relationship with the body as well, I assume changes a lot for your clients after having children.
Mhm.
And then there's probably, well, I mean, maybe it does tie in. There's probably also shame that goes with being, doing parenthood correctly, whatever that means. And yeah, I'm curious how does motherhood kind of change that relationship to sex, to relationships, to, I don't know, personality? Should it change your personality? It kind of sometimes does. I don't know.
Motherhood?
I don't know. I feel like maybe not personality, but like everyone has that one friend who like had a kid and then just disappeared off the face of the planet. And then of course I have other friends who have kids and they're like, we're doing everything we were doing before. There's just a kid here now. So I think it goes both ways.
I mean, becoming a mom, I don't think we talk about this enough. And the word matrescence was recently added to the dictionary, which is crazy that other words were there that are completely like, let's say, that don't carry the weight and importance that matrescence does. But becoming a mom changes your brain, right? So if your personality changes through that process, honestly, totally expected, in my opinion. But I mean, I know your question was about the body, and I will get to that, but I think it's such a massive transition to go through, like life changing, not only in terms of what is expected of you, but in terms of how you relate to yourself and also what it means for your identity, right? And I think that takes me personally, it's taken me 3 years to process that.
Okay.
And I'm sure they'll still unpack new things along the way. But yeah, I think for not for every woman out there, but for those that it feels challenging, I think it's so normal and natural. And I think we tend to do the opposite. We tend to portray becoming a mom or becoming a parent as this kind of very positive, like beautiful experience, but we don't talk enough about the reality of the other side of things. And in that process, I think we shame those parents maybe don't have these overflowing positive feelings or that find themselves at odds with themselves in terms of, I used to love something that I like career wise, right? And now I've lost that. And now there's a grieving process behind that. But instead, to the outside world, I should just be talking about how happy I am. Right. So I think on a personal level, not personal, but on a individual level, I think that makes a lot of sense. And then when it comes to their bodies, how that changes, I think, yeah, it goes from this body is my own, well, hopefully, right? Ownership of my body to now my body is a source of nutrition. So it's giving. And I think sometimes navigating the back and forth between giving my own now sexual context, right? Goes from a very non-sexual, like nurturing place to now I'm suddenly supposed to just, turn into this erotic individual. And I think that going that switch back and forth, I think it's also difficult, right? And then also taking your body back because, depending on for how long you breastfeed, that is also a process, right?
Yeah, it is wild to me. I personally, I've never wanted children ever. Uh, but I think some people just know. But it has been interesting. Like now in my 30s, so like obviously a lot of my friends have kids, and I don't, I don't get people who like hate children. I'm not one of those, but I just
Yeah.
never wanted my own. But yeah, it's just it's been quite interesting to see because yeah, I really have zero judgment because it's not something that I ever intend to do. I remember one friend, she had her son, and I was like, okay, like, how was week one, which is probably not a good question to ask. And she was like, I don't even have postpartum depression. And I would say, and she didn't, it's been years now. And she
Yeah.
was like, but if I could describe week one of having my baby who like, love and light in the world or whatever, but like I would say despair. Despair is what described that week for me. And I was
Yeah.
like, you're not really selling it. I was like, yikes. Not in like a judgmental way, but like, yeah, I could look at that and see why despair was the word she chose because yeah, she was just like probably not feeling very like I'm hesitant to use this was the word she used to describe it. She's like, I don't feel clean because I've just like
Mhm.
gone through like essentially like a big medical change and then I can't really like shower because I've opened wounds like
Oh.
she's like I feel gross. I'm not eating what I want to be eating. I'm not sleeping when I want to sleep. I was like, yeah, okay, that's enough in
Yeah.
itself. So, yeah, no, I feel like they tell you it's supposed to be like sunshine and roses and then I don't it doesn't look like it. So I guess how can people prepare for that change? Because yeah, you mentioned that it was going from yeah, like trying to go from like being your body is your own to your body's a sort of source of nutrients to like then trying to transition back into like being a sexual being. Like what a nightmare.
Yeah, I think it definitely does affect the dynamics in couples massively, right? Not just on a sexual level, but also how they communicate. But I think you were wanting to ask, how can women prepare or transition?
Yeah, how do you mentally gear up for the despair?
I don't know if you can.
Okay, fair.
I think okay, no, I do have one suggestion. If you're in a partnership, right? Because there's also women that choose to do this on their own. But if you're no, actually no, I'm gonna say that for women who choose to do this on their own as well. To me, they're like my heroes. Single parents are just like superhumans to me, so amazing. But if you're gonna do this, I think having a very solid support system around you will be it's just no words to describe the how helpful and valuable that is as part of this transition. And to in your relationship with your partner to be very solid in terms of communications, in terms of managing expectations, addressing mental load. So I think support system is the word for me in terms of how to transition that or how to have an easier transition. And I think what's happened also as well, we've gone from very community collective driven ways of raising children to a lot of individuals moving to other parts of the country or across the world like you and I. And when we lose that family support system, right, we become this expectation that we have to do everything on our own, right? That's really heavy. And so again, tapping into a community or support system where you live, I think can be a game changer.
Definitely. Yeah, I feel like the people who have that network, it gets a lot easier.
Yeah.
Um, yeah. But I think that's true of a lot of things too, not just parenthood in general. I
Yeah.
feel like if you have community,
It's good. It's important for the mental health.
different people for different things. Yeah, very, very important for general mental health. I guess as we kind of wrap up, yeah, I'm curious just a little bit about your thoughts on yeah, just general development, either in therapy or in counseling, how either how has it changed since you started, or, how do you continue to develop, and what does that look like, as a curious person yourself?
Okay, so I'll answer the first part. I mean, I think it's safe to say that it's really interesting to see how AI is changing the field. And it's very interesting to see that even clients that I see in my practice, how they're also tapping into this as additional support, right? So asking for questions or for guidance, right? Or helping them unpack a situation that they react correctly or, you know, that kind of thing. So I think that's very interesting. I'm curious to see how that, how that changes the way that we relate, right? I don't want to go in and assume or say, oh, this is all negative, but I am curious in terms of if people are seeking this more as a kind of a sounding board instead of talking to someone, whether it's a counselor or a friend, right? What does that do to our way of relating to one another?
Mhm.
What does that mean for emotional safety? What does that mean for, I don't know, isolating myself a little bit more? But I feel like then I'm kind of going into a negative way of thinking. So I want to stay open and yeah, curious to see how that will continue impacting my work.
So, what's something you're excited to learn in the future or improve upon
Mm,
for yourself
what am I excited to learn? Like a
about counseling or anything else?
No, no, no. This is crazy, Emily, but I'm constantly learning. Like, I feel like I never stop. I'm a lifelong learner, and spend a lot of money on it as well. I'm very curious, well, not curious, but I want to continue expanding my skills around somatic psychology, right? And just really continuing to integrate that even more into my work. But I think also maybe in the very, far future to learn a little bit more around like group counseling,
Okay.
right? Because I mean, there is an loneliness epidemic, right? We're becoming increasingly more isolated. And I think at some point it's going to become more about navigating group dynamics and helping individuals kind of come out of their shell. And sometimes working one on one feels very
Mhm.
exhausting or very draining. And then kind of maybe doing it in a group setting perhaps feels a little bit more attainable but that's more in the far off future.
Perfect. Anything you want to say that you feel we didn't get to touch on?
No, it was such a lovely conversation. Thank you. Really
Yeah,
enjoyed it.
thank you for coming on. It was
Yeah,
so nice to talk to you today.
yeah, let's do it again.
I'm down. Let's do it.